Hi everyone, and welcome to my presentation on the heart valves. I just want to thank you for viewing my presentation in advance, and I hope that you enjoy it. So, why do we have heart valves? Hearts have four valves: the mitral valve, the tricuspid valve, the aortic valve, and the pulmonary valve. Our hearts also have four chambers: two upper chambers called the atria, one on the left and one on the right, and two ventricles, which are lower chambers, one on the left and one on the right as well. There is a valve at the end of each chamber which blood must pass through in order to make its way through our heart, and once it has passed the valve, it closes to prevent backflow of the blood, and that is the purpose for our heart valves. Did you know that the valves have many names? The mitral valve is also known as the bicuspid valve. It is also called an atrioventricular valve, and so is the tricuspid valve because they are both found between the atria and the ventricles. The aortic and pulmonary or pulmonic valve are also known as the semilunar valves. So the first valve I'll be talking about is the mitral or bicuspid valve. It has two leaflets. I don't have an image on this PowerPoint slide, but the next one I do, so I'll show that later on. The mitral valve is one of the AV or atrioventricular valves. It's found on the left side of the heart between the left atria and ventricle. Blood will flow into the atria from the pulmonary vein. At this point, the valve is closed, so it looks like this. When the atria contracts, the valve opens like so, and the blood is able to go into the left ventricle. It then closes again for a second time because when the ventricle contracts, we don't want the blood going back into the atria. We want it going through the aortic valve to the aorta and to our body. I'm just going to cross this out. I just like the image because of how it showed the mitral valve. So then the mitral valve is held down by the chordae tendineae. It attaches to the wall of the ventricle. So this is what it looks like here, and this is a really good image showing it attached to the inside of the ventricle wall. The next valve that I'll be talking about is the tricuspid valve. It has three leaflets. So this is that image that I was talking about right here. The tricuspid valve has 1, 2, and 3 leaflets, and the bicuspid valve has 1, 2. So that's the difference between the two. And the other difference would be that the mitral valve is on the left side of the heart, and the tricuspid valve is found on the right side of the heart between our right atria and our right ventricle, which also makes it an atrioventricular valve. The right atria receives oxygen-deficient blood from the superior and inferior vena cava. The valve will open and close in the same way and at the same times as the mitral valve did. It is also attached by chordae tendineae, which is also shown really well in this picture, to the inside wall of the ventricle. Now we'll talk about the semilunar valves. They're located in between the ventricles and the large arteries that take blood away from the heart to the body or the lungs. So that's the pulmonary artery or the aorta. The ventricles contract at the same time, therefore the valves open and close at the same time, just like the atrioventricular valves. The pulmonary semilunar valve prevents oxygen-deficient blood from flowing back into the right ventricle, so that's that one here. It's going to stop the blood from flowing back in. And then the aortic semilunar valve is found over here, and it's going to stop the blood from flowing back into the left ventricle. So here's just an overview of the heart valves. Number 1 is the pulmonary semilunar valve. Number 4 is the tricuspid valve. Number 2 on the left side of our heart is the aortic semilunar valve. And then there is the mitral valve, which is number 3. I also just want to point out that they're held down by the chordae tendineae. What makes our heartbeat sound the way that it does? The lub is created by the atrioventricular valves closing, and the dub is created by the semilunar valves closing. Heart murmurs and arrhythmias can alter the normal sounds of a heart's beat. So now we'll talk about heart valve problems. The problems that I'll be covering is valve regurgitation, which is a leaky valve that doesn't fully prevent backflow. Stenosis is the narrowing of valves, and then there's MVP, which is mitral valve prolapse. There's rheumatic fever, which causes some of these heart problems, and then we'll be talking about heart murmurs as well. So valve regurgitation. Valve regurgitation is another name for leaky valves. It occurs when the backflow is not completely stopped or controlled as it should be. It can happen when the valve is closing or when it should be completely closed. The heart has to work harder to pump the same amount of blood. It may come on suddenly or develop over the years. Treatment is usually repair or replacement of the valve surgically, although some people can live with valve regurgitation and have no problems at all. Stenosis. So what is it? It's when the heart valves narrow. The valve does not open properly due to stiffness, thickness, or it may fuse together a little bit. So this is a good picture right here. This is a properly opened valve, and this is a narrowed valve. So even when it's open, there's not enough room for the blood to flow through properly. So the heart is going to work harder to pump the blood, which can lead to enlarged heart muscle, which leads to its own complications, and the body can suffer from reduced oxygen supply because the heart is not able to keep up with pumping the blood. So what causes it? It can be caused by age, just getting older, or by malformed valve, which is also called a bicuspid valve. So this is not referring to the mitral valve, but just a malformed valve. They're actually referred to by the same name. So treatment of heart valve stenosis would be surgery to replace or repair the valve, although some medications do help to ease the symptoms, and depending on how bad the stenosis is, some people can just have or take medications to help that. MVP, or mitral valve prolapse, is when the two flaps of the mitral valve do not close smoothly or evenly. I've provided a video on the next slide for you to see, but when the valve closes, the flaps balloon back into the left atria, and that's shown in the second video. Regurgitation can also occur, and that's seen in the third video. That can cause a murmur, so that's when the blood actually goes back flowing into the vein, into the atria. It's usually harmless, but sometimes requires treatment with medication or a valve repair or replacement. It's detected during a normal physical with a stethoscope. Symptoms may include dizziness, chest pain, fatigue, palpitations, or orthopnea, which is shortness of breath when laying flat or while doing activity. The first video in the next slide is a normal mitral valve working. Rheumatic fever is an inflammatory disease that is a complication of an improperly treated group A streptococcus infection. It's rare and mainly affects 5 to 15-year-olds, although it can affect all ages. Symptoms include fever, pain in joints, red swollen joints, chest pain, heart murmur, and fatigue. Some more unusual symptoms include outbursts of inappropriate crying or laughing and jerky movements. The complications of rheumatic fever is what we want to focus on. They include valve stenosis, valve regurgitation, and heart damage that can cause atrial fibrillation and heart failure later in life. I've also included the Jones. It's the abbreviation of the guidelines provided by the American Heart Association to help doctors clinically diagnose rheumatic fever. So J stands for joints. Just them being painful, red, and swollen. Then the O is actually a small heart, and it stands for carditis. N is nodules, which are non-painful but abnormal lumps under the skin, usually on the joints. E stands for elevated ESR or CRP. Because I work in a lab, I actually draw these blood tests from patients all the time, and I've actually been able to go to hematology and see how ESR is tested. So ESR stands for erythrocyte sedimentation rate. We draw the blood into a skinny, longer tube. It's different than normal blood test tubes. The blood is mixed in the tube by a lab tech. They then insert it into a machine, and it will watch the erythrocytes fall. And basically the result is a measurement of how much plasma is left at the top, how many millimeters. And I can't remember if it's high or low, which one is bad, but one or the other will indicate if there is inflammation or problems with the joints. And then CRP stands for C-reactive protein. It's a protein that comes from the liver, and it's released a few hours after tissue injury. So you can imagine, of course, with what we've learned, that if there's tissue injury, there's going to be inflammation. So if your CRP is elevated, it indicates inflammation usually. And then S stands for Sydenham chorea, and those are those jerky movements that are one of the unusual symptoms of rheumatic fever. So heart murmurs, there's an innocent one. It's a sound made by normal heart circulation. They're common in infants and children. The murmur usually subsides by adulthood. They are harmless and don't require treatment. They do not create symptoms and do not cause heart problems or diseases. These murmurs may change during excitement or fear, but still do not cause problems. Some murmurs may require an ECG or an EEG, echocardiogram, to rule out any possibility of heart disease. So now we'll talk about heart murmurs that are caused by valve disorders or other. Murmurs caused by valve disorders are usually stenosis or regurgitation related. Systolic murmurs occur when the heart is in systole, so contraction. They indicate aortic stenosis, MVP, or large heart muscle due to cardiomyopathy. And then there's diastolic murmurs, which occur when the heart is in diastole, so relaxation. They indicate mitral or tricuspid stenosis, aortic or pulmonic regurgitation, or tumors in the heart chamber. Murmurs can be caused by other things as well, such as pregnancy, fever, and anemia. Pulmonary atresia is my special focus for my heart valve presentation. It is a congenital heart defect that is very serious and becomes life-threatening very quickly, which is why it is usually diagnosed within hours or days, sometimes from the time that the baby is born. The pulmonary valve doesn't form properly. Instead of forming a proper opening, it forms completely closed with a solid sheet of tissue where the opening should be. So I'm just going to circle this for you. It is completely closed off. So blood, oxygen deficient blood, cannot get from the ventricle to the pulmonary artery in order to go to the lungs. So while I'm focusing on the image, I'm just going to stop and talk about the image more, just because when I was reading about this defect, it was hard to understand until I understood a fetus's heart. So fetuses have natural openings in their hearts. One is the foramen oval. It's actually not labeled in this image, so I'm just going to point to it for you. It's right there. So it is actually a hole in the septum of the heart which opens up the two atria to each other. And then another natural passageway in the fetus's heart is the ductus arteriosus, and it is pointed out right here, but I'll just point it out again. It's an opening between the aorta and the pulmonary artery. So when a baby is in the womb, the mother's placenta provides the oxygen and the baby doesn't have lung function. So these natural openings allow more of the blood to bypass the baby's lungs until birth. So it's really cool that babies have these natural openings, because if it weren't for them, the blood would be trapped in the right side of the heart and no blood would be able to get to the lungs. It would be fatal very quickly after birth. But it's because of these natural openings that the baby can still manage to circulate blood throughout the heart and to its lungs. Because the blood can pass from the right to the left side of the heart, so oxygen deficient blood can actually come to the right side of the heart over here. And even though it's deficient, it can still go up to the aorta, and then because of the ductus arteriosus, it's able to get into the pulmonary artery so that it can go to the lungs and be reoxygenated or become oxygen-rich blood. So that is very cool that these natural openings are there. So I'm just going to flip to the next slide. It doesn't have the image, but now that you kind of understand how the fetus's heart works, it's pretty cool with understanding this defect. So these babies normally have a bluish cast to their skin because of the lack of oxygen. X-rays, ECGs, EEGs, and cardiac catheterization can help to diagnose this defect. Medications are the first step to treating babies with this congenital heart defect. A medication called prostaglandin can keep the natural openings open until the doctors decide which procedure is best for the baby's case. As I said before, pulmonary atresia is one defect that is usually present with numerous other defects, which is the tetralogy of Fallot. So it may take the doctors some time to figure out which defect to work on first and when to work on which ones and which will work best. So some of the procedures include radiofrequency ablation and balloon valvotomy. A doctor may apply a small amount of energy, radiofrequency ablation, or use a wire to create a small hole in the pulmonary valve, which he can insert a balloon into to open the valve leaflets. Balloon atrial septostomy is another procedure that doctors can do. They use a balloon to open the foramen ovale more to allow more blood flow to the lungs. And then a stent can be placed in the ductus arteriosus, which also would allow more blood flow to the lungs. And then sometimes these babies need to undergo heart surgeries. So the first one would be shunting. The doctors would create a bypass from the aorta to the pulmonary artery to allow for adequate blood flow to the lungs, but babies usually outgrow this within a couple of months. There's the Glenn procedure. One of the large veins that brings blood back to the heart would get directly connected to the pulmonary artery, and the other large vein would continue to bring blood back to the right side of the heart that would flow through the surgically repaired pulmonary valve. So that would be either the superior or inferior vena cava veins. And then the Fontaine procedure is when all the blood that returns to the heart would be diverted directly to the pulmonary artery. This is usually the option if the right ventricle remains too small. So that could be because other defects that are present with the pulmonary atresia, or just because the heart isn't functioning properly, it doesn't develop properly. And then the last option would be when the heart is too damaged to repair, a heart transplant would be the last solution. So here are my references. They continue on the next slide, and then I also just posted the link where I found the video. There are lots of videos about all things heart, not really ECGs, but lots of cool different heart demonstrations on that website, so that's really cool to check out as well if you guys have time. Now we've reached the end of my heart valve presentation. I just want to thank everyone who's watched this, and I hope that you enjoyed it. I can't wait to hear your feedback. Here are 3 questions, and I can't wait to hear from you. Thank you very much.